Dr. McCarthy here. What we're going to be explaining is insurance billing today. So we typically get questions about billing once a month by multiple people, and they're a little unsure about deductible, premium, co-insurance. So I'm going to break down that in the most basic form that I can. If you have a car insurance, it works similar like that. So in order to have insurance, typically you have to pay for it unless you get it through your job for free. So typically you're paying for it monthly or every 3 months. It costs you money. In this case, we'll just say your premium, your monthly bill to have insurance is $100. That $100 allows you to be in your insurance plan. That's it. That's all of it. From there, there's other stipulations that could apply. So for some people, they'll have a $100 premium. That's so that way they can have an insurance, and they never get a bill in the mail because they have a great insurance plan and their premium covers everything. It covers everything. But for 95% of the world, you just have a premium, and then you typically will have a deductible. Now, best way that I can describe a deductible is they're like vegetables, and you have to eat your vegetables before you get your dessert. So your deductible, we'll say, is $100. We'll keep simple numbers over here. Your deductible is $100. So let's say you go to the doctor, and each time you go to the doctor, it's $25. You have to go to the doctor 4 times, pay $25 to the doctor out of pocket. That's your patient responsibility to eat up your deductible, which was $100. And then after that, you start to get benefits from your insurance. So most insurances will have a copay. And we'll go with an easy number over here, $25. Or a co-insurance, and we'll go again with an easy number, 25%. Some insurances have both, believe it or not. It's not becoming uncommon. So this is what we consider the dessert. Once you eat up your deductible, then your patient responsibility only becomes this. Now, you could go see the doctor, and a lot of times they will collect your copay right up front, and then they'll bill you the patient responsibility from the deductible later after they sent it to the insurance, and the insurance comes back and they tell you what the patient owes. That's called an EOB, an explanation of benefits. So if you get an EOB in the mail from your insurance company, it's saying, hey, there, person, we noticed you went to the doctor's office and it was $50. Just so you know, this is breaking down all the services, the patient responsibilities. So I'll go through some mock things in here to help explain this a little bit more. So patient responsibility is always what the patient is going to owe. And again, 95% of the time when you go visit a doctor, you're going to owe something. There's very few insurance plans where all you do is you pay the premium and that's it. Even the best insurance plans that don't have a deductible usually have a copay or a co-insurance with it. So just because you have health insurance, that doesn't entitle you to free health care. There's more expenses with it. I know it stinks. I wish it was the latter, but it's not. So if you go to our office and our services costs, let's say each time you walk through the door, it costs $50. That's what it costs, our bill, every single time you come through the door. Hypothetically, not correct, but hypothetically in this scenario. Yes, you are paying your monthly premium. Every month you're paying $100 to have your insurance, but you have a deductible of $100. So your first 2 visits to our office, in this hypothetical situation of a bill of $50 each visit, your first 2 visits would be 100% your patient responsibility. Now let's throw a little wrench in there. Let's say you have a $25 copay. and still you've met zero of your deductible, you will still have, after 2 visits, you will still have $100 patient responsibility. We could collect the $25 on your first visit and your second visit initially, so that would be $50 collected over the counter for your copay, but you'll still have $25 remaining from your patient responsibility due to your deductible not being met. Now let's say you've met your deductible and you come in, and again, our bill is $50. If your deductible has been met, if you ate your vegetables, you ate all the vegetables on your plate, now you get your dessert. So it's only a $25 visit. So the bill's $50, but the patient responsibility in that scenario is 25%. $25. Co-insurance works a little differently. It's not as like concrete as a copay. What co-insurance means, it's a percentage of the cost of the visit that day. So to keep the math simple, we'll say the bill was $100. You met your deductible, so you met your deductible. So this is not going to be $100 for the patient responsibility. Now we go by the co-insurance, and 25% of the total bill now means you have a $25 patient responsibility. There's other things that work at play here. You can have an individual deductible. You can also have a family deductible. So there's a chance if 2 people in your family have met the individual deductible, which contributes to the family deductible, there's a chance you don't have to worry about your vegetables at that point because the family deductible's been met. There's also another thing called out-of-pocket deductible, and it's usually OOP deductible. What that means is if you spend X amount of dollars within the year, your insurance says you no longer have to worry about anything. So it's one of those situations where if you had someone in the family that had a heart attack, cancer, surgery, something like that, where you spent a lot of money that year through the insurance, after a certain limit, the insurance company recognizes you guys had a hectic year, we're going to give you a break. You don't have to worry about patient responsibility. Again, that is not a deductible. That is called the out-of-pocket deductible. So in whole, this is how billing works. There's more that goes with it, but every time you come in for the year, you will bring your insurance card in and we'll verify your insurance, and that will be your insurance for the year. Now, if you switch insurance plans, your deductible, your premiums, all this stuff, your insurance benefits, more than likely will change. You could go from Blue Cross to United Healthcare within the same company, and your insurance benefits will change. And it changes year to year. Insurance has changed. So even though you've been paying yourself for this insurance called Blue Cross Blue Shield B plan, in 2000, the year 2000, it can change from the next year drastically. So that's why we verify benefits every single year, because they change. Alrighty, this is Dr. McCarthy, signing out.